Good morning, I'm Dr. Ramos-Platt. I'm one of the neurologists at the Children's Hospital of Los Angeles. And today I'm going to be touching on what you should be asking from your Duchenne team. In 2009, 84 clinicians who take care of boys, and in our case some girls, with Duchenne, were asked to come up with a set of guidelines of what parents should be expecting from their care teams and what the care teams should be providing to their boys with Duchenne muscular dystrophy. Those guidelines were published. They were pushed by a lot of organizations that advocate for patients with Duchenne muscular dystrophy. All of you are here because you have some tie with Duchenne, whether or not it is a family member or someone else that you care about. And I will not be going over how the diagnosis is made, and I will have a separate talk about steroids, and my colleague, Dr. Kay, will be talking about the orthopedic complications. So those are things that I will not get into discussion at this point. These are my disclosures. I really appreciate what the pharmacy industry has been doing for our boys with Duchenne. They brought us the first FDA-approved drug to help a subset of boys with Duchenne, and it's very exciting. And I'm very happy to participate in their advisory boards. I just can't take anything from them. I also would like to disclose that CHLA is going to be a local site. We are working with UCLA, who is our hub site, for Sarepta's multi-center trial for exon 45 and 53 skipping, and we are also a site for Santhera. The very first thing that we think is important is that you have a team that takes care of your child. Duchenne is a multi-level, multi-system disorder. So there are some patients, when they come to us, and they come to us a little bit later, that they were only taken care of by one doctor. But we know that there are multiple systems involved. And so the very first thing that you should be asking from your provider is, I need a team of physicians that understand what my child is going through, what my child's progression will be, and what to do to intervene to advocate for my child. There are a lot of different people that are involved: cardiology, pulmonology, pediatrician, orthopedic surgeon, different therapists. The next thing that you would need is one point person. A point person that if something goes wrong, you can get to pretty easily. Usually this person is in the form of a nurse practitioner, a nurse, sometimes it's the physician, but you do need a point person. So these are the things you're going to be asking from your care team. If something were to happen to our child, who do I go to? Who do I call first, rather than trying to figure it out on your own? You do need a point physician as well. This is a person that will help coordinate the care. And the CDC guidelines say that it can be from various different specialties. Sometimes it can be an orthopedic surgeon, a neurologist, a PMNR or rehabilitation physician. It can also be a pediatrician who has a special interest and expertise in Duchenne muscular dystrophy. It can also be a primary care physician. And in some areas in the country, that is the case. You have to make sure that this is a good fit for you as a family as well as your child. Centers differ. We built our center one way, and it's not to say that it's the right way. We're trying to follow the standards of care, but there are other centers that have different focuses and depends on what is best for you. There are some centers that are more very heavy research specific, and if that's the center for you, then that's where you go. There are other centers that are more care specific. We tend to see the patients more frequently, communicate a little bit more frequently. And there are some centers, and I will mention Dr. Wong's program at Cincinnati that I understand is a combination of both, where she does two things very well. You want to make sure that whoever you follow with, you have access to clinical trials. If they do not have it at their clinical trial, at their center, that they can send you where you need to go for a clinical trial so that they have that updated information. Because this is where the progress happens. Location is very important. In those guidelines, they do recommend that you want to choose a place where it's accessible for you. we have a population where a lot of our families are government insurance. It's a little bit more difficult. Transportation is difficult. And for them, location being in an area where there are bus lines and subway lines are very important to them, and that's why they follow with us. But if you have the ability to go to a different location that is more specific for what your family needs, that's something that the family can help with. Certifications are very important. You want to make sure that they are sponsored or certified by bodies that look at the overall care for Duchenne. There are several different organizations, including CureDuchenne, that makes their recommendations about what makes a center appropriate. Some of you are also with Parent Project Muscular Dystrophy, and of course, the Muscular Dystrophy Association. They all decide and help out that whether or not we are meeting those standards of care. This should be your core team. You need to have a coordinating physician, a care coordinator. In our center, it's our nurse, Arlene, who's sitting right there in the third row. You need to be able to have some access to research, cardiac support, pulmonary support, nutrition support, bone health, endocrinology, and from what I hear from other centers as well, sometimes this is one of the hardest things to find. Therapists, particularly those who are very knowledgeable about Duchenne, psychosocial support, and genetic support. Although that's also very hard to find. Genetic counselors are so difficult. They're so rare. It's as soon as somebody enters genetic counseling school, they have 8 offers on the table for when they graduate. They're very much in demand. You want to choose a team that has familiarity with Duchenne, its course, interventions, and of course, they will advocate for you. There are multiple levels of Duchenne. It is not something that is static. It's not like some of the other disorders that neurologists take care of. It changes, and as it changes, the need changes. There are some centers that are pediatric centers only, and that's us. We take care of patients from the time they're diagnosed to the age 21. And one of the encouraging things is now there are also adult care centers where they're taking care of patients who have been diagnosed with Duchenne into their 20s and 30s. And we are hoping, as more medications come out, more treatments come out even beyond. You should be asking from your child's Duchenne care team for psychosocial support. And this can be in the form of, and this can be in different forms. A social worker. Social workers can help get you situated with different resources in the community. There are also social workers who act as counseling social workers. Especially during the time of diagnosis, for the first 6 to 12 months after the diagnosis is made, psychosocial support is very important because it's a big transition for families. You have, I don't think I have to let you all know that you've lived it. When there is a transition, when boys go from ambulatory to non-ambulatory, it's another transition that we really need the help of our psychosocial support colleagues. Psychologists can also act as counselors, and psychiatrists can help with counseling but also with medications. There is a high risk for depression with Duchenne in both the family members and, of course, the patient. And sometimes we do recommend for medications to help with that. And that's when we ask for our psychiatry support. Especially in the early the early parts of Duchenne, sometimes it is not the weakness that actually presents. We have had several patients that they didn't present to us as weakness. They actually presented to us for developmental delay, or they presented to us for autism. 30% of patients with Duchenne have learning problems. They run the autistic spectrum. 10% can have seizures as well. And we see that in our population. We do need to provide psychosocial support for those patients, not only emotionally, but also for the ones that have learning problems. Our psychosocial support needs to be an advocate for our patients in the school system. In California, depending on where you are, it's a little bit hit and miss. Sometimes the schools do not follow the individual education plans that they promised or that's appropriate, and so you do need someone to go to bat for your child to get those services in the school system. We do need to have therapists who understand Duchenne muscular dystrophy. One of the saddest stories that we have had come out of our clinic is that we had a little boy with Duchenne. He wasn't diagnosed yet. He was diagnosed with weakness. And his therapist had him holding a weight and then squatting. They had him holding a weight and doing back bends. And what that ended up doing is that it caused more damage than good. And that by the time we saw him at 5 years of age, 5, he could barely walk. So without having someone who's familiar with it, you may be getting the wrong types of information and be doing the wrong interventions, which do more harm than good. Pushing patients with Duchenne to work harder, to lift heavy weights, this is not the right course to take. We usually do recommend, gentle exercises when they are younger, to continue with community exercise as much as they can tolerate, to be part of the community. Aqua therapy has always been something that our therapists have recommended. And you want to be at a center or ask your center for updated information with experience with things like bracing, casting, surgeries, when they should be done. And I will have Dr. K talk about that part. And then how to manage complications. This is a list of all the different things that you should be asking from your care team, and this is from the standards of care. Every time you should be having your strength tested, and that's usually manual testing. We also have different parameters from that. Time testing, it is very important to understand the time testing because it tells us a couple of things. One, it tells us where along the course is your son, or in our rare cases, our daughters. And these are very standardized. A timed 10-minute walk test or run test. How long does it take to stand up from the floor from a seated position? How long does it take to climb up and down stairs? How far can you walk in 6 minutes? If you are not doing this at least once every 6 months or so, when you are in a care center, ask your physicians for this, because this will give you an idea how far along you are. Also, having this baseline is very important when we're talking about clinical trials. If your son is going to qualify for a clinical trial, having a baseline with these time testing will help you speed things along. Our therapists also ask about different things like activities of daily living and how to modify different activities so that it is available for, to modify the activity so that our patients can continue with their self-care. We do have different motor function tests. At our center, we do the motor function test battery, and we also do the North Star ambulatory test, and these are standards that you should be asking your care providers for. This is our hardest area to cover, bone health. We do know that bone health is very important in Duchenne. 40% of our patients will end up with a fracture who have Duchenne muscular dystrophy. That number is higher when we treat with steroids. But with steroids, there are the pros and cons. I will be talking about that later today in the afternoon for some of the patients that have been recently diagnosed. The recommendation is for a bone density evaluation before the onset of steroid starting. When they become non-ambulatory, if they have a fracture, and yearly after that. We have just started this at Children's. It took us about 5 years to get this started, but other centers are catching up with this as well. And the other question that we would have for usually an endocrinologist is, when should we be escalating the treatments for bone health? When is vitamin D not enough anymore? If you're on steroids, you really should be on vitamin D. If you are vitamin D deficient, we should be pushing you up to an appropriate level before restarting a lower dose of supplement. If you have a fracture, we should be really considering bisphosphonates. And these are questions that you need to ask your center. Pulmonary complications. Pulmonology involvement changes with time. Usually with your first visit, he should see a pulmonologist. And we would normally do pulmonary function tests as young as about 5 or 6 if they are pretty capable, but usually around 7, and we would repeat this every year. When they become non-ambulatory, we want to repeat these every 6 months. You want a center that is able to do sleep studies. Sleep disordered breathing is one of the common complications of Duchenne. And sleep centers are hard to come by also. If you can't find one inside the center that you're at, ask them to refer you out to get a sleep study. Also, ability to set up interventions. And that includes different things based on the stage of the patient. So at first, pulmonary function test, albuterol when they get sick, assessing for sleep disordered breathing, sleep study, when to use a cough assist. These are questions that should be asked. And whether or not to do a tracheostomy. You should be asking your team about cardiac care. You should have a cardiologist on your care team. That is one of the core team members. But the cardiologist is not only for the patient. The cardiologist is also for the mothers who are carriers. There is a small percentage of mothers who they do not have the physical weakness, but they can develop the cardiomyopathy. So I ask our patients, mothers, if you are a carrier, please get checked. You need to have cardiac studies every 5 years, echo and EKG. Also for your daughters who may be carriers, very important to get cardiology involved for them too. So even though it doesn't manifest in your daughter, they should probably still be genetically tested if mom is a carrier. You want to have a cardiologist who has experience in 2 different things. Pediatric cardiologist, adult cardiologist, they all subspecialize. But the subspecialty that would be most helpful are those that subspecialize in arrhythmias and also those who subspecialize in heart failure. Patients with Duchenne are already prone to heart failure, and you want someone that has expertise with that. You want to be able to do echocardiograms. The recommendation is that after the age of 6, well, there's a baseline, then after the age of 6, between the ages of 6 and 10, you want to have an echocardiogram every 2 years, or as is necessary. After the age of 10, you want that echocardiogram every year. Sometimes you need it more depending on how advanced your child is. We have just been starting to use cardiac MRI. Most of our boys at the age of 10 do get a baseline cardiac MRI. Nutrition support is very important also in Duchenne care. You should be asking your center for a nutrition referral. Overnutrition and undernutrition are problems with Duchenne muscular dystrophy. So you want to keep the BMI between 10 and 85%. This becomes even more of a problem when patients become non-ambulatory. It becomes even more of a problem when we start steroids. It's not uncommon for boys with Duchenne to have constipation. GI motility is affected, especially when you're not moving as much, and so that can happen. There are rare complications of poor GI motility, and so you want to make sure that your center has a way to refer your son to a gastroenterologist who has expertise in GI motility problems, and that they're able to do different types of studies to look at motility issues. There are some patients that if they get really constipated, if things are really backed up, it can lead to a condition called acute gastrointestinal distension, and that can be very painful, and that can affect the way that a patient breathes. If that were to happen, that is something that we have to urgently treat. I think I went over that in the previous slides. So the standards of care for Duchenne muscular, this is a summary slide. I do have a newer version, but we couldn't get it up on time. But basically, what you want to make sure is that if you have all of these caregivers, you have a point physician that can summarize all of this for other people that will take care of your son. You want to make sure that your care providers are all talking, because we do get some of those patients where they come in, they have different recommendations from different doctors, no one has talked to each other, and none of the recommendations are being done. So when you have a team of physicians, you want to make sure that they all do talk to each other so that they come up with a comprehensive plan together and to provide the best care for your son. This is just a summary of, we need a pulmonologist, cardiologist. I did put one other line here because when it comes to surgery, there is a section in the guidelines that to make the anesthesiologist aware because there are some anesthetics that can be dangerous for your son. These tend to be ones that can cause a condition called malignant hyperthermia. And we see that happen in patients, not only with Duchenne, but with a lot of the muscle diseases. Orthopedic interventions, when to do it. AFOs, nutrition assessment, bone health. Exercise has to be supervised by a therapist, at least the plan. And then, I'll be talking about this later on, but steroids should be offered. We get a lot of referrals that the line still says, steroids are controversial, or we did not offer steroids because it's controversial. That was probably true when I was in medical school, but it's not the case anymore. They should be offered. And if they're not being offered to you, you should be asking about those. That's all the current slides I have. I'll take questions if there are any.
I'm from Alabama.
Okay.
And I think it's overwhelming with the team of physicians approach. You know, if you don't have that or if you don't know exactly, what is your advice about how to go and seek out a place for treatment where you do have the world-class team like you do?
Sometimes sometimes it is on the parent to try to like piece together that, or you have to actually go to your physician and say, look, I need this. Your PMD say, I need this. I need you to help coordinate my care for my son this way. If you can't go to one of the, I don't know, if you can't go to a center that is around you, is there, I don't know if there's anything.
Like Children's of Alabama is great.
Yeah.
But they still, they don't do stretching for every clinic visit. They don't, there's still things that they don't do. So I think there's a movement towards all of that. But is there, kind of a standard of care that's established as one, as the standard bearer?
The center that we try to be like is actually Cincinnati. Brenda Wong's program in Cincinnati. She's very good. When we started our program, we really didn't have much. And so we relied on other centers to help push our agenda. We relied on parents to go to our patient relations and say, you guys don't have this, I want this, how can I get it? So parents actually did drive the development of our program. We had UCLA, who is more established than we are. They've been there a lot longer. They helped us set up the program. So basically it's finding a physician in your center that can really advocate for you, saying, we need to have this. Because Arlene and I, we've seen this, we've built the program. So we started off with just the neurologist. And we started picking up the pieces based on what our patients needed. And I'm guessing the University of Alabama, is it Birmingham?
Yes.
Birmingham, they're pretty good because I think they're a neuromuscular center.
Yes.
So if there is something that you need, talk to your I don't know who your point physician, if it's a neurologist, talk to a neurologist about getting these things done for you. Because you can build a team. It shouldn't be static. Parents have a say. We see to the age of 21. We are trying to see if we can get it older than that, but just the way that I guess the state is it's usually, for CCS, because we're California Children's Service Center, it's usually 0 to age 21. We're going to see how we can make changes. Again, we are 5 years old, so we are still building. So we're hoping to build the adult side as well.
Any other center where the children can go and one can go to?
After 21? I'm sorry?
Any center near in this place which is certified?
So, okay. So there are a couple of centers. In Southern California, UCLA has both a pediatric and an adult center. We have a pediatric center, and we are the 2 CCS centers. Up north, they have a couple of centers. Children's Hospital of Orange County has an MDA clinic. Loma Linda has an MDA clinic, and I believe San Diego also has an MDA clinic.